Hi everyone, have you ever felt that your surrounding is spinning around you and causing you to lose your balance? If you do, you are probably experiencing BPPV or fluid imbalance in the ear, a more common term that we use in Singapore and Malaysia. My name is Zino, physiotherapist from the Rehab Studio. Benign Paroxysmal Positional Vertigo (BPPV) is a unique spinning sensation that usually triggered by specific changes of the head position. BPPV is the most common cause of dizziness. The prevalence of BPPV increased with age, and studies found that elderly tend to have difficulty in describing their symptoms. This leads to the delay in effective treatment and consequences like fall, fracture, traumatic brain injury, and so on. The purpose of this video is to improve the awareness of BPPV. Towards the end of this video, I'll be showing you two home-based maneuvers which aim to help you with your BPPV. The vestibular system can be divided into two main systems: the central system, which comprises the brain and the brainstem, and the peripheral system, which comprises the inner ear and the pathway to the brainstem. The vestibular system in the inner ear detects our head movements and sends this information to our brain as well as other systems for appropriate balancing response. BPPV is caused by the dislodge of calcium crystal autocornea from the inner ear balance system into the nearby semicircular canal. Any specific changes of the head position can cause the autocornea to move inside the semicircular canal, which sends false signal to the brain and results in the symptoms of BPPV. The treatment objective of the maneuver is to reposition these calcium crystals back into the balance systems. This explains why medication usually doesn't help with the symptoms of BPPV. There are three types of BPPV: the posterior, the anterior, and the lateral. The posterior BPPV is the most common type of BPPV and can be treated with the same maneuver as the anterior BPPV. The lateral BPPV is less common and requires another type of treatment maneuver. The common symptoms of BPPV are dizziness with the nature of spinning sensation. The feeling of surrounding environment is constantly moving, nausea, vomit, and unsteadiness. These symptoms usually triggered by specific changes of the head position like turning on the bed, lying down from sitting, sitting up from lying, bending forward, or extending your neck. If your symptoms do not get triggered by specific changes of the head position, it is very likely that it is not BPPV. Some other conditions that may have the similar symptoms as BPPV are stroke, Meniere's disease, infection of the inner ear, or migraine. To differentiate this condition from BPPV, for example stroke, they usually accompanied with some other symptoms like numbness, weakness, loss of consciousness, or headache. If you are not sure, please seek professional medical help. For safety reasons, please do not perform this maneuver if you are aged 65 and above, you have hypertension, diabetic, high cholesterol, history of heart disease, spinal problems, limited movement at your neck area, osteoporosis, rheumatoid arthritis, difficulty in following instructions, and severe obesity. These are not the contraindication of the maneuvers, but more of a precaution and require professional medical review before making a decision on whether you are suitable for this maneuver. We will begin with Epley maneuver for posterior and anterior BPPV. If this maneuver does not trigger any symptoms, you can proceed to try Lempert maneuver for lateral BPPV. If both maneuvers do not trigger any symptoms or you do not feel any improvement after these maneuvers, please seek professional medical review. For Epley maneuver, you will need a pillow and a bed. Let's have a look at how does a complete Epley maneuver look like before we move on to a step-to-step instructions. Long sitting on your bed. The position of the pillow should be at the area where, when you lie down, it is right underneath your upper back, so that your neck is at around 30-degree extension. In long sitting, turn your face 45 degrees to the affected ear. After this, lie down with the pillow underneath your upper back, so that your neck is at around 30-degree extension. Wait for 1 minute. You are expected to feel the symptoms within 1 minute. Remain calm and do not move. Wait for the symptoms to subside. If you do not feel any symptoms after 1 minute, stop and restart with the opposite side. If the opposite side still does not produce any symptoms, do not continue. You can try the Lempert maneuver for lateral BPPV. After waiting for 1 minute, or when your symptoms subsided, turn your head 90 degrees to the opposite side and wait for another 1 minute. After this, maintain the position of your head in relation to your body and turn 90 degrees from lying on your back to side lying. Wait for another 1 minute. After 1 minute, bring both of your legs to the edge of the bed and sit up while continue to maintain your 45-degree head turn to the opposite side. You can repeat this up to 3 times a day, and you should feel better if your dizziness is caused by posterior or anterior BPPV. Next, we will move on to Lempert maneuver. You will need a pillow and a bed. This is how a complete Lempert maneuver looks like. Start by lying flat on a pillow and face up. Turn your head 90 degrees to the affected ear and hold for 1 minute. You are expected to feel the symptoms. Keep yourself calm and wait for the symptoms to go off. If you do not feel any symptoms even after 1 minute, stop and restart with the opposite side. If your opposite side still does not produce any symptoms after 1 minute, do not continue. Very likely that your dizziness is not caused by lateral BPPV. If you have tried the maneuver for anterior or posterior BPPV and produce no symptoms, do not continue any of these maneuvers again and seek professional medical advice. After 1 minute, turn your head back to facing up. Wait for 1 minute. After this, turn your head together with your body 90 degrees to the non-affected side. Wait for another 1 minute. After 1 minute, turn your head and body together 90 degrees again so that you are now facing down. Prop yourself up with your elbow and make sure your head is parallel to the ground. Wait for another 1 minute. After 1 minute, continue to turn your head and body together 90 degrees in the same direction again so that you are now lying side on your affected ear. Wait for another 1 minute. After 1 minute, bring both of your legs to the edge of the bed and slowly sit yourself up. You can repeat this up to 3 times a day and you should feel better if your dizziness is caused by lateral BPPV. Remember, if you are not sure if your dizziness is caused by BPPV or you fall under the do not perform list, please do not perform any of these maneuvers. You need to seek professional medical help. If you do not feel any improvement after performing these maneuvers, you need to seek professional medical help too. If you enjoyed this video, you can subscribe to my channel for more educational videos and home-based exercises on different conditions. My name is Zeno, physiotherapist from the Rehab Studio.